Hi everyone, welcome to week 2. This week we are focusing on the hybrid model. Now bear with me, this is some heavier clinical jargon this week and we will take our times to discuss and process it and go through it. I might split up this lecture into a couple different videos and take some pauses. So the hybrid model in this chapter has to do with the tasks that you have to accomplish during a crisis. And they don't always move in a stepwise linear progression because that is life. Nothing is perfect and sometimes things don't go according to a plan, hence why a crisis occurs. So that process needs to be something like a hybrid model, and that's why it's a really good model to apply during a crisis because there are so many different components that come up. So one of the biggest differences between this hybrid crisis intervention model and other models that are used with other mental health professionals would be that they're going in right at the height of the crisis and they don't have time to gather all that background supplemental information through a psych assessment. So this is brand new information going into a situation where you may or may not know the individuals that are involved. So a key component of a highly functioning crisis worker is the ability to take the data available and make some meaningful sense of it. So a crisis call comes in and they take that referral information, basically the identifying information and any background history they have, and figure out how do I make sense of it, what could possibly be going on, what is my best approach with a hybrid model. Now, because of the importance of timing and the intensity and acuity of a crisis situation, it can be overwhelming. Absolutely. This might be somewhat unsettling to some human service workers who are accustomed to having complete social and psychological workups available to them before they proceed with an intervention. And the word intervention doesn't always mean literally going into a room and having an intervention with someone. Intervention is almost a flexible world in the mental health crisis field, meaning, this is the intervention, this is the tool that we have used in this intervention process. So it's actually intervention as a whole, and then interventions. What tools did we use? Did we use a psych assessment? Did we use a depression assessment, suicide assessment? Or in therapy, what type of worksheets did we use in cognitive behavior therapy? Or did we use art therapy, reality therapy, trauma therapy? So intervention is one big umbrella term, and then also can mean what are the types of tools that we used. Hope I'm not sounding redundant, but I hope you understand. And if you don't, like I said, email me. All right, that being said, when it comes to a crisis, the ability to quickly evaluate the degree of client disequilibrium and immobility, meaning how much has their life been thrown off kilter, and their immobility. What level are they what is their capacity of functioning? How are they functioning? Are they incapacitated? And what is their decision making? And are they alert and oriented ×3? Do they know what time it is? Do they know what date it is? Do they know where they are? So that's why we have introduced this hybrid task model and the triage assessment form that should be in your weekly reading. It's important to note that through a crisis intervention, the assessment process is ongoing. It's not, boom, we have arrived and we're doing your assessment. It is ongoing because it takes some time to gather an idea of what's going on, have people get to the point where they are able to function, and see if they have the level of functioning and capacity to answer questions, get an idea of what's going on, and how to make sure that they are safe. That being said, we also have to get supplemental information and collateral information from other sources. So if you go to a crisis scene with a family, you need to talk to maybe their caseworker, their doctors, the schools, other family members. So continuing on the topic of the assessment, as I've said, the assessment is ongoing. It's ongoing, and Sometimes crisis workers might assume that the crisis appears on the surface to have been resolved. And I will say this till I'm blue in the face, never assume. Never ever assume. Assumptions are dangerous. So that being said, usually the issues are not resolved right away. So the balance sheet of assessing a client's crisis in terms of severity, current emotional status, alternatives, situational supports, coping mechanisms, resources, and access to resources, I will say that, and to services, and the level of lethality is never complete until the client has achieved his or her pre-crisis level of mobility, equilibrium, and autonomy. So are they able to focus and function independently? Do they have the resources and the services that they need? And do they have any type of safety plan in place? I will add that in there because that's very important. And do they have a good balance and a good trajectory to maintain that balance? The resumption of pre-crisis equilibrium does not imply that the client needs no longer needs any type of long-term therapy, medical treatment, any type of developmental work. But it does mean that the crisis worker's job is done and the acute phase of the crisis is over. Acute meaning top tier level of severity. I am going to end chapter 3 lecture now, and I will post chapter 4 in a separate lecture. I forgot to end. Don't mind me.